So I'd like to just introduce the very first consult video conference, and we've selected Dr. Howard Tobin, one of our preeminent members and founding members of the American Academy of Cosmetic Surgery. And so, Howard, we'd like to ask you a few questions, and we appreciate your
All right.
contribution to the consult this month. But my first question is, how did you transition from a head and neck surgeon into a cosmetic surgeon?
Well, there were quite a few factors that entered into it. First of all, when I was doing head and neck cancer surgery, of course, there was a lot of reconstruction involved. So the surgical procedures weren't really much of a challenge. And I had been exposed to some cosmetic surgery in my residency and my fellowship. We did rhinoplasties and some facelifts, so it wasn't entirely new to me. So as I was doing more and more reconstructive surgery, I was kind of looking at where I was heading. And I practice in a relatively small city, and I could see a change in head and neck surgery. My bread and butter operation was thyroidectomies, and a lot of those were being treated medically. And a lot of patients were starting to go to major medical centers because chemotherapy was getting introduced. And although I actually used to give my own chemotherapy, I could see a change on the horizon. So I began emphasizing more of the facial plastic procedures. And then, quite honestly, what got me cosmetic surgery with Dick Weber, I had a rare opportunity to travel to China with Dick for several weeks, and we were teaching over at the plastic surgery hospital in Beijing. And as I spent time and got to know Dick, he sort of steered me towards cosmetic surgery. And when I came back from that trip, liposuction was just being introduced into the tree, and Dick said to me, you better learn that. So I went out to California, and Julie Newman was putting on a course. And so after that, I began to learn liposuction. I actually went down and visited a fellow who became really one of my closest friends, Gary Fenno. And Gary taught me liposuction. And I sent out a notice, and I told them that I was limiting my practice to cosmetic surgery, and kind of the rest was history.
And the rest was history. So most of the early members in our academy, the founding fathers, if you were going to give a 2-sentence description of a couple of the key people, who would you pick, and what would you say in just a couple sentences about each one?
Dick Webster, of course, predominant figure in our academy, a plastic surgeon who was disenchanted with the plastic surgeon's approach to cosmetic surgery. Julie Newman was a firebrand. Julie stimulated a lot of people, and I was very close to Julie. And although he was kind of a crazy guy, I think he did an awful lot to develop our society. And then in the facial plastic realm, in my career, Jan Beacon was one of the ones that really stimulated. And another one was Jack Anderson, who was very, very encouraging to me. Those are the ones that come to mind initially. There were a lot of others, Mark, but those were the ones that I think influenced me more than anybody else.
Okay, and if you had to pick a favorite procedure, a cosmetic procedure, what would that be?
Oh, God. I get asked that so much. I think the two that I really like the best, rhinoplasty and breast reduction.
Okay. And
breast
you
reduction,
have...
I like breast reduction because the patients love it so much.
Okay. And let me ask you this. You started a fellowship training program. Any idea how many fellows Howard Tobin has trained in Texas?
I think we've trained somewhere between 15 and 20. I'm not real sure about that, but I think the number falls somewhere in that realm.
And can you just name a few of your fellows who have gone on to become active with the Academy?
Well, yeah, I've been very fortunate. Angelo Cozzolina was one of my early fellows, and he's had a very prominent role in the Academy and the board. Similarly, Jay Iavi, who is just a wonderful, wonderful. Also, Jay is almost like family to me now, and of course, he's made tremendous contributions to the board. John Paranek was an excellent one. He went on to teach down at LSU and has made quite a name for himself. Several others, but those are the ones that come to mind right away.
Okay. And did you have any idea that they would be the stars that they would later become while they were doing your fellowship?
Yeah, you can tell. You can tell. When they're training, you can tell. You know, there's some people who are natural surgeons, and there's some people who struggle. There's some people who are devoted to what they're doing. There are some people when you really wonder whether they're really motivated enough. And so, yes, you can tell, and you can tell pretty quickly.
And do you have any particular anecdotal story of one of your favorite outcomes and why?
Yeah, I'm always reminded of a young girl that came in, and she had a very marked asymmetry of her breasts. One breast was very large, and one breast was plastic. It was a challenging case, and a reduction on one and an augmentation on the other. And she came in, maybe 3 or 4 months after her surgery. And she said, Dr. Tobin, I never told you this, but you totally changed my life. I was married to an abusive husband. And because of my appearance, I was afraid to get out of the marriage. He said, after you operated on me, my self-esteem to the point where this guy, I've got a wonderful boyfriend, and I've got a whole new life ahead of me. Now that's the kind of experience that makes you realize you're really doing something worthwhile.
And, I think that's important for people to realize the effect that we can have positively impacting their lives. If you were going to compare your interest in flying, what are the attributes that make a good pilot as well as a good surgeon?
It's very interesting because medicine has been learning from flying in the sense that, in our OR controls now, we have more of a aviation type of checklist. And flying is a real discipline. Surgery is a discipline too. If you want to be an expert pilot, keep training, you've got to keep flying, studying, you've got to keep listening. I think if you want to be a great surgeon, you've got to do the same thing. You've got to study, try and watch what other people do, learn from your own experience. So to me, although there are a lot of differences, I see more similarities than differences, quite honestly. And of course,
Okay.
flying is a passion of mine, so it always has been and it still is.
So, Dr. Tobin, if a young or any member of our academy should come and visit you in Abilene, Texas, where would you take them out for a world-class dinner?
Well, I might take them out to Perini's, which is pretty well known throughout the country. Tom Perini cooked for President Bush, so he's pretty well known. But if I really were going to take them to a good place, I'd bring them out to my ranch, and we'd cook some brisket and some ribs, and then we'd really have a Texas dinner.
Now you're talking. Dr. Tobin, based on your experience, wisdom, and knowledge, what are the top 3 items you would tell a cosmetic surgeon in 2021?
Well, I think, first of all, if you're going to go into this field nowadays, you need good training. And training means a fellowship program. it's not like the old Wild West when I started. I've been doing this for 50 years now, and we had nothing but self-training. We visited people, but now we do have good training programs. So I think you've got to take a fellowship training program to really get into this field. The second thing I think is that you've got to be true to yourself. Do what you know you can do well, and do what you think is best for the patient. Uh, don't chase the buck. You'll make a good living in this field. You don't have to get wealthy to be satisfied in life. And quite honestly, I think it's a tough competitive field now, and we've gotten more and more dependent on marketing, and I understand that. And marketing has become important in building up a practice, but don't be fooled by your marketing. Your marketing is just an opportunity to get a patient to come in and visit you. From then on in, you're not selling, you're offering a service. So I think be true to yourself, be true to your patients, do what you know you can do well, and get good training and keep training, training, and training. And I think that's the best advice I can give.
Okay. And let me ask you, what would be the one instrument that Howard Tobin absolutely could not give up?
The Bovie.
The Bovie, okay.
Pretty much everything I do is with a Bovie.
Okay. And is it true that you have some instruments that you inherited from Dick Webster?
Yes, I do. Actually, Cleo gave them to me after Dick had died, and I have them in a little box frame in my office. Something I really treasure. And Webster needle holders are not named after Dick Webster, by the way. It was another Webster. So.
And can you share with us what's in that box? What instruments did Cleo? And that's his wife. What did she give you?
Yeah. To tell you the truth, I can't exactly remember right now. It's been in my office for so long, but it's a little small forceps and something else. I can't remember. I'm embarrassed to tell you that I've kind of forgotten exactly what it was. I actually have some other instruments that other people have given me. So you'll have to forgive me. I guess it's a sign of my age that I've forgotten exactly what's in that box.
Well, I could dig it up. I actually, for the audience, have had the opportunity and pleasure to visit Dr. Tobin. He has a beautiful office in Abilene, a beautiful surgery center, accredited. And I saw that on the wall as I was visiting, and I took a photograph of it. But I'd have to go back through the albums and check out where it is. But I was very impressed that you had it, and they look like they were very memorable items worth keeping. So anyhow, but
yeah, that was a gift from Cleo. Yeah.
And so in final wrap up, what advice would you give to the leadership of AACS?
Well, Mark, it may sound a little self-serving, but I think we're tending to forget history. And I don't want you to feel like I'm neglected. I'm very content with my life and my position. But I think the Academy is losing sight of history to a certain extent. And history is very important. We have to learn by what we've done in the past, what our gains have been, and what our mistakes have been. And somehow I get the impression that we're not really paying attention. A lot of us older guys aren't going to be around much longer. In fact, I may be the oldest active member of the Academy right now, and so I think we've got to pay a little bit more attention to our past because we can learn a lot from it. There is so much that us older surgeons can talk about and teach, and it's not just new procedures and it's not just technique. A lot of it is based on what we've learned over many, many years and many hundreds or perhaps thousands of procedures. And not everything that is new is great. There's an awful lot. I mean, one of the things I think about is liposuction. I've often thought I'd like to give a lecture on liposuction. And what I'd be telling people is I don't do anything different than I did 35 years ago, and it still works great. So I would say don't lose track of history. It's an important part of the future.
No, and I think those are wise words. 2 years ago at our national meeting, we were fortunate to have about 16 or 17 of our past presidents be involved with the annual scientific meeting. And I'm hoping we can continue that tradition. But anyhow, well, thank you very much, Dr. Tobin, for sharing a few highlights with us tonight. It's always a pleasure speaking to you, and I hope to see you soon.
Well, I appreciate it, Mark, and it's been a pleasure to visit with you.
Thanks. Have a good night.
Yep. Bye-bye now.